Good afternoon to everyone, and I'm delighted to speak of one topic which is motor neuron diseases with a homeopathic perspective, and I have conducted a study of 31 cases at XIXth OVMs, that's owned with the Institute of Homeopathy and Allied Medical Sciences. Though MND is one disease which is not very commonly known by most of the doctors and most of the people, but of late it has been increasing rampantly and people are suffering a lot. The motor neuron diseases are a group of neurological disorders that selectively affect motor neurons, the cells that control voluntary muscle activity, including speaking, walking, breathing, swallowing, general movement of the body. It is a fast progressive degenerative disease with a devastating illness which leads to progressive paralysis and eventual death. Considered to be an incurable disease where medical science does not have much to offer even in arresting the fast progression. At XIXth OVM's clinics, some encouraging results have been obtained with homeopathy. Though not cured, but certainly improvement has been seen in many cases, which encouraged me to conduct research or study and bring at this international conference of 19th AHML for discussion and sharing experiences amongst the learned renowned homeopaths. In USA, MND is commonly known as ALS. ALS refers to the specific subset of pathologically identical diseases, other diseases of the motor neuron that should not be confused with ALS. MND include spinobulbar muscular atrophy, spinal muscular atrophy, Charcot-Marie-Tooth disease, and many others. ALS or log-gearing disease. PLS is primary lateral sclerosis, progressive muscular atrophy, bulbar, in which we have pseudobulbar, where we come with spasticity, and progressive bulbar palsy is spastic and flaccid. In 1869, it was a French neurologist, Jean-Martin Charcot, first suggested grouping of together disparate conditions that affects the lateral horn and spinal cord. Causes. About 90% of cases of MND are sporadic, meaning that the patient has no family history of ALS and the cases appear to have occurred with no known cause. Genetic factors are suspected to be important in determining an individual's susceptibility to disease, and there is some weak evidence to suggest that onset can be triggered by as yet unknown environmental factors. Approximately 10% of cases are familial MND, defined either by a family history of MND or by testing positive for a known genetic mutation associated with the disease. Out of 31 cases studied in our study, only one patient had the family history of MND. The study of 31 cases, which was conducted, out of 31, there were 22 male and 9 were female. Youngest age and the male was 34. Incidentally, female was also the youngest was 34, but eldest male was 72 years and eldest female was 63 years. All were pre-diagnosed cases with the help of MRI, EMGs, NCVs by neurologists and conducted at the different reputable hospitals of different states, including AIMS, PJ, etc. Pathophysiology. Skeletal muscles are innervated by a group of neurons located in the ventral horns of the spinal cord, which project out the ventral roots to the muscle cell. These nerve cells are themselves innervated by the corticospinal tract of upper motor neurons that project from the motor cortex of the brain. On macroscopic pathology, there is a degeneration of the ventral horns of the spinal cord as well as atrophy of the ventral roots in the brain. Atrophy may be present in the frontal and temporal lobes. On the microscopic examination, neurons may show spongiosis, the presence of astrocytes, and a number of inclusions, including characteristics, skin-like inclusions, vein bodies, and localization. Now, coming to the signs and symptoms, it is previous in European country, it is from 50 to 70, but in our country like India, we are seeing the cases as young as even 30 falling to this particular disease. So that I have put it from 35 to 70, include progressive weakness, muscle wasting, fasciculations, spasticity or stiffness in the arms and legs, overactive tendon reflexes, dragging of foot, unilateral muscle wasting in the hands, slurred speech, choking and suffocation, difficulty in swallowing, especially liquids, and increased salivation. Now, how this disease presents itself? The classic form is called ALS. It tends to be focal in onset with a particular group of muscles affected first. This presents with a mixture of upper and lower motor neuron features, for example, with a wasted fasciculating biceps with the best easily obtained biceps with left. In 3 recognized patterns, it's a limb onset, by far the commonest, bulbar onset, 20% of cases, respiratory onset, the least common. The rarer variants in the disease can present in 2 ways, with pure upper motor neuron features, that is primary lateral sclerosis, with pure lower motor neuron, progressive muscular atrophy. MND is an uncommon degenerative disorder of motor neurons which leads to progressive paralysis of the cranial and skeletal muscles. The onset is insidious. First symptoms may include stumbling, weakened grip, hoarse voice, cramp of muscle wasting. The condition is incurable and leads to death within a few years of diagnosis, generally 1 to 5 years. Death is most commonly due to the respiratory muscle weakness and ventilatory failure. Anterior horn cells resulting in lower motor neuron, corticospinal tract cells resulting in upper motor neuron, and motor nuclei in brainstem resulting in both upper and lower motor lesions, as sensory lesions are rare. Interestingly, memory and intellect usually remain intact in these patients. Normally, when we talk of a patients who are suffering from neurological disorders, paralysis and all that, like dementia, Alzheimer's and all that, memory is a very important part to consider. Cranial nerves affecting sight and lower sacral segment of the spinal cord affecting continence are spared. This is a good part. Varied presentation and unpredictable, sometimes very rapid disease progression. Now, progressive bulbar palsy affects around 25%. Both upper motor and lower motor neuron may be involved. The dysarthria and dysphagia, lower motor neuron, you may have a nasal speech, regurgitation of fluid via nose.